Hi everyone, and welcome to PHAMCAST. I'm Margaret Wallis-Duffy, and I am so excited because here we are in Preventative Health Awareness Month 2025, year number 3, and boy oh boy is this movement gaining momentum. You know, one of my passions is sharing not only preventative health education, but collaborating with other healthcare professionals. And today, not only are you in for a treat, but I'm in for a treat because I get to have a conversation and a discussion and share education with all of you with not one, but 2 friends and colleagues that I've had the privilege to work with, to make a difference with. And that to me is what this preventative health movement is all about. So without further ado, today we're going to be talking all about your eyes being the window to your health and your body. And because it's Eyes Are a Window to Your Health Day on FAM, we have an entire focus day. And why do we have that? Because of this incredible woman that's sitting next to me. So I'm really honored and excited to have next to me Dr. Carolyn Teske, behavioral optometrist, who I also get to call my friend and someone that I've learned so much from over the course of many years now. We've done many things together, including a whole series of eye health, you know, from cataracts to seniors. Welcome, Dr. Teske.
Thank you so much, Mark. It's always a pleasure to be with you.
Yes, and you know, you really are different than a lot of optometrists in that you really do look at the body holistically. And that's why we had to have another guest on, which I'm really excited as well to introduce you to, because as a proud registered massage therapist, you know how much I really am champion the importance of what we do as massage therapists. But I get today to have a colleague and a friend, Joanne Ratte, founder of Lymphatics Canada, a massage therapist specializing in lymphatic health. I too am learning from her and using some of her techniques, and she is also a FAMbassador. So Joanne, welcome to the show.
Thanks for having me, Mark. Hi, Carolyn.
Hi.
So, you know, ladies, it's really important to talk about right from the top of the show because this is unusual. Two massage therapists, but we're sitting here in an optometry office talking to an optometrist. People are probably wondering, how does that happen? Dr. Teske, let's start out by talking about that first.
For sure. Well, I think it's been over a decade since we have known each other and worked together. Better together.
Absolutely.
Is what you started sharing, and certainly every day with every patient we feel, you know, the benefit of integrative management of your health.
Absolutely. And so when we actually think about eyes and the important role they play in overall health, we don't think that a massage therapist would have anything to do with working alongside an optometrist. But oh, you're oh so wrong. In fact, there was a time where I actually had a treatment table in this office giving treatment. And can we explain to the audience, Dr. Teske, why that's the case? Because we don't massage eyeballs, do we, Joanne? Right? Not directly anyway, but we do play a role. And can you explain to the audience why we play a role as massage therapists in eye health?
Of course, for sure. So, you know, every system in our body is connected. And I think when you look at the body like that as a whole, you recognize that the eyes are an extension of the brain, and the brain feeds muscle, and muscle is innervated by nerves, and nerves need circulation. So all of it is attached. And I think when one system requires support, then it falls over domino effect to the other systems.
Absolutely. And we have certainly learned from one another over the years and have seen tremendous changes in outcomes in patients that we have the privilege of treating together, which is really, really cool. And that really speaks to what we wanted to come and talk about today. And you see my shirt, Love Your Lymphatics Day, because although this is Eye Health Day in FAM, we actually have a whole day dedicated to lymphatic health, which is why we wanted to have Joanne Ratte with us, because she's a massage therapist, but really specializing in lymphatic health. So Joanne, let's talk a little bit about the role that lymphatics can play, you know, with eyes. You know, so first of all, what is the lymphatic system? Because so many people aren't even going to know what that is.
Yeah, the lymphatic system basically has 2 main functions. The first one is to kill stuff that essentially makes us sick. And then the second one is to clean and filter stuff that is then reused by the body. So it plays a big role in immunity, and it plays a huge role in circulation.
Yes, and so as a massage therapist, I mean, we both know the laying on of hands and how powerful it can be in impacting all systems of the body. But can you speak a little bit to, because, and if I do say so myself, I can say that you have treated Dr. Teske and her eye condition as well. Speak to, you know, how that kind of works together when it comes to the periorbital area and how lymphatics can play a role.
Yeah, for sure. So there's several lymphatic channels that serve the eyes. So there's lots of drainage that takes place from the eyes to various channels. So lots of lymphatic disorders can be identified through the eyes. For example, if you have sinus conditions or inflammation, Dr. Teske can speak to that as well. But the upper eyelid and the outer half of the lower lid drain to nodes that are located around the ear. And then the small part, there's a small part of the middle upper eyelid and the inner half of the lower lid drain to nodes that are around the chin. So there's very different pathways for various parts of the eye. And you can get a lot of things going on with the eyes that require drainage to those pathways and those nodes.
And I know, Dr. Teske, that you've witnessed Joanne's work firsthand yourself.
Absolutely.
So, and you actually have a picture to prove it, right? The
sure
before of the miraculous work of Joanne. Can you speak to that? And from an optometrist perspective, an optometrist lens, pun intended, you know, what does that mean for people? And when you're doing an eye exam, I know you've referred to Joanne a lot, because how does that play a role in helping improve the outcomes for your patients?
Well, you know, pain generally elicits, you know, seeking care. And often I'm sought out because people have eye pain. Of course, the eye exam needs to happen so that we know that the eye itself is fine, but often it is around the eye, really relating to sinus, that is presenting the pain. And that's where I would suggest to the patient that they may want to consider lymphatic drainage. Now, my own personal story and the photo that you referred to, I would wake up quite routinely. I would say probably 2 years ago we started this journey, Joanne. And I would have a lot of swelling, enough that it looked like someone had punched me.
Yeah.
It didn't feel bruised and didn't look bruised, but it certainly was quite swollen. So I'm an eye doctor. I knew it was an allergy. I knew it was an infection. There wasn't discharge. You know, the health professionals that I was reaching out to really didn't have an answer. Now, gut issues were a big deal for me at the time. Some lower limb pain and extremity issues. And really, you know, with Joanne's support, you know, we worked on the gut. We worked on resetting the nervous system so that I was in a healing state and not so much in fight or flight. And as we've calmed my nervous system, or I've worked towards that, healed the gut through lymphatic drainage, it's been 2 years. I've not had another occurrence of that swollen periorbital area.
It's really remarkable, and I've seen, and I've referred, as you know, many people to Joanne, because her work is powerful, but also the fact that she teaches you at what you can be doing as well to help yourself, not just inside your office. And that's what we love as massage therapists, is reaching beyond our treatment room walls and helping. But what I also loved about what you said as an eye doctor is that you, and I'm going to sing your praises, because, you know, I am your patient, and I've learned so much from you, but you're different in a lot of ways, because you aren't just looking at the eye. Okay, there's no infection or there's no disease in the eye necessarily, but you're curious. You're a curious clinician that says, well, hang on though, what else can I do to help this patient? And in your case, you know, lymphatics has made a massive difference in your eye health. And thus, you talked about your lower limb and your gut. It's all connected, as we've all said from the beginning of this conversation today. So how powerful is it that the lymphatic system and a massage therapist can be doing this like Joanne is, which is really incredible. And I know you've referred people to her as well and seen similar results.
Absolutely, for sure.
So Joanne, I know we love here at PHAMCAST to give practical tools. Now, when it's Love Your Lymphatics Day coming up during Preventative Health Month, you're going to be actually showing things to do at home. But before we do anything to show today, can you just give everybody a sense of, if they came to Lymphatics Canada, what can they expect in a lymphatic treatment? Because, you know, as a massage therapist, people sort of understand, oh, okay, I know what to expect. But they don't quite know what to expect when they're going to go have a lymphatic health treatment. Can you speak to that a little bit?
Yeah, well, the first thing when you come in is that we're going to really get to know each other. So I look at the body as a whole, and I look at you as a whole person. So that includes emotional, mental, physical, all of those things. You may come in with, like Dr. Teske, with swelling in the eye, but we're going to look at your gut as well. Everything is so connected that we'll be getting into everything. So you'll be on a journey for sure. You'll be on a journey.
I love that. So when it comes to actual practical things that someone can do, and I know you've shown some of these things to Dr. Teske, which she proudly does daily so that she can maintain the gains that she's had when she's had treatment with you. Can you explain sort of what is the big six? And we don't have to go through all of them, but what is the big six? What does that mean? And then empower us with a couple of things that people can take home today that they could do to perhaps help their eye health and their overall health.
For sure. So the first thing is we want to give credit to Dr. Perry Nicholson in New Jersey for coming up with the big six and sharing it with everybody. It's truly profound. It is something that you commit to. It only takes a minute or two, but every single day is necessary for sure to affect change. So it's basically 6 main drainage points of the body, and you're going to clear those every single day. Once you get those big 6 cleared, then anything you do after that is that much better, and you drain that much more. So today, if you wanted to start with things for eyes in particular, then I would suggest clearing the collarbone, which is always your first point. Right. And to do that, just very lightly want to sweep towards the collarbone in that little divot. If you shrug your shoulders, you'll see that hole there. That's exactly where you want to be. So you're just going to lightly sweep towards the collarbone there. And then your second point is always behind the ears. 2 of the biggest lymph nodes in the body reside behind the ears. So again, that part of the eyelid, upper and lower, will drain to these nodes behind the ears. So you're going to do the same thing. You're going to sweep down towards the collarbone, just very lightly, as though you had a nickel on the top of your hand. That's the amount of pressure that you're going to use with that.
I love that you're bringing that up. I'm going to interrupt only because I love that you're giving that instruction, because it's important. So I'm going to ask you the question, why? Because of course we get, I think, trained, and certainly a lot of massage therapists do, that, you know, deeper is better, and that is not the case with lymphatic health. Can you explain why it's important to go lightly and why that's more effective?
Of course. Yeah. So you have a superficial lymphatic system, which resides just underneath the skin. And so if you use any kind of pressure on that, you're actually going to temporarily collapse the system. So you want to make sure that you're really light so that everything can drain. And believe it or not, the lighter is absolutely profound.
And I love that, and I wanted to stop and have that noted, because more is not better when it comes to pressure in the lymphatics. And like you said, done regularly, it can be profound changes. I've seen, for all of you watching, some of the before and afters, and hopefully you're going to show some of those during Love Your Lymphatics Day, because it is remarkable to see the changes in swelling. I know, Dr. Teske, your own personal experience has been incredible, but in so many areas of the body. So, okay, back to, so your collarbone, you're behind the ear, and
with the collarbone, then you do behind the ears. And then from there, anything that you do to the face, you just want to point towards the collarbone. So you can use a dry brush, you can use your hands, you just want to sweep everything towards the collarbone, towards the back of the ears, and then down. So it doesn't matter what you do, as long as you clear the collarbone and the main nodes behind the ears first. Okay. Everything from the head drains down to the collarbone. Everything from the rest of the body drains up to the left side.
Okay, so let's state that again. So everything, state that again so everybody's got it. So when they're practicing this at home, they're effective.
Of course, so everything from your head drains to the collarbone. If you follow the line of the rib cage on the right-hand side, everything up and over drains to the right. The entire rest of the body drains to the left-hand side.
Amazing. Gosh, our bodies are incredible, aren't they? And all interconnected. Yeah. It is incredible.
Every day I learn more and more.
Right? Mm-hmm. Right. And you're suggesting daily to be doing this for people to see results.
Yep.
Now, I remember in the very first year of FAM, you did a bunch of videos, and we might share some of those again. And one of the things is really talking about movement and literally moving stagnant fluids in our body. Can you just speak to that? We've only got a minute or so here left and with you today. And I wanted to sort of talk about that because we want to make this fun and accessible and easy for everyone to do, because when doing that regular, it makes a huge difference. What did you tell everybody in that first year that was so powerful?
For sure. So your lymphatic system is not like your circulatory system. So your circulatory system has the heart to pump blood throughout the body. Your lymphatic system doesn't have anything to pump it. So what actually pumps the lymphatic fluid is your muscles. So movement is key, but before you do any movement at all, you want to be doing the big six that Perry has taught us. So that starts again with the collarbone behind the ears, and then I'll show you the rest on February 14th. So yeah, stick around for that. But yeah, you have to clear those and then just move, just keep the body moving.
I love that. And that's why, movement is medicine. It's foundation. That's why we're so passionate about musculoskeletal health. Joanne, I always learn from you. I know that as a FAMbassador, you are one of the cherished ones. I still get people reaching out from year one saying, I learned so much. I can't wait till Joanne's coming back. Tell us a little, we're just going to wrap up here. Lymphatics Canada, where are you? How can we get a hold of you? And just generally speaking, who can benefit from lymphatic health?
Oh my goodness, everybody. Yeah, absolutely everybody. If you have any kind of inflammation, any chronic diseases, autoimmune, cancer, anything, name it, I've probably got a solution for you. So yeah, you can reach me at 647-210-7001. That's the phone number. You can email me at lymphaticscanada@gmail.ca or joanne@lymphaticscanada.ca. And yeah, I look forward to hearing from anybody who has any questions. And hope to see you all February 14th for sure.
For sure. Well, thank you for joining us, Joanne. And we cannot wait to love our lymphatics on February 14th. But we're going to be back here in a few moments more with Dr. Teske. We're going to be talking about eyes are the window to your body and to your health. Stay tuned. We'll be right back here at FAMCAST.